Hello. We're going to talk a little today about meniscus tears. This is a very common injury that I see in the knee, and it's actually the most common surgical procedure that I perform is treatment of a tear in the meniscus. So what exactly is the meniscus? Well, the meniscus is the shock absorber or the cushioning inside the knee. So here I have a model of a knee. We're going to move the kneecap out of the way. We're going to flex the knee so that you can see the meniscus. The meniscus are these C-shaped structures here. We have one on the medial side of the knee and one on the lateral side. The medial side is more commonly torn, but they definitely both can be injured. What causes a tear in the meniscus? Well, there's several reasons that the meniscus can tear. One is an acute injury. This can be a traumatic injury, a sports injury, or it can be something as simple as twisting the knee in an awkward position when getting up from a chair. Another type of meniscus tear is a degenerative tear, where as a normal process of aging, the meniscus becomes more brittle and it loses its rubbery structure and is much more prone to tearing, and it can fray at the edges. What happens when you get a tear in the meniscus? What sort of symptoms would you see? Well, most meniscus tears cause some combination of pain in the knee, swelling in the knee is a very common symptom, and occasionally, especially for the more severe tears, they can cause mechanical symptoms such as clicking, locking of the knee, the inability to straighten the knee. But pain is probably by far the most common and consistent complaint. So what are the treatment options if you discover that you do have a tear in your meniscus? Well, first we can definitely treat these non-operatively. You can treat these with medications, with physical therapy. Sometimes an injection into the knee may calm down the symptoms, and it may not give you enough problems that you need anything else to be done. Now, if that is not the case, if non-operative treatment fails, then sometimes surgery is required to treat a tear in the meniscus. And there are several ways to treat these, and a lot of that depends on your age, your activity level, and the overall state of health of the knee. In young kids, we definitely try to fix the meniscus as much as possible, because the meniscus serves to protect the articular cartilage of the knee from developing arthritis. The younger you are when you have a tear in the meniscus, the more likely you are to develop that in the future. So in children, meniscal repairs perform much more commonly. Once you reach adulthood, the treatment is usually geared more toward partial meniscectomy or trimming out of the tear of the meniscus. This can get rid of the symptoms of the tear. It does put you at a little more risk for arthritis down the road, but repairing the meniscus in adults sometimes is a fruitless option. There's really no good way to get it to heal. The more arthritis that you have in the knee, the less likely we are to be successful with a repair of the meniscus. Now, this surgery is done arthroscopically. It can be done with 2 small incisions in the front of the knee. It's done as an outpatient, and the recovery can be very quick. If your knee is otherwise healthy with no arthritis, some people are back to work after only a few days. If you have some arthritis in the knee, it may take you a few weeks. Or if we perform a meniscal repair, then you may need 3 to 4 months, including some physical therapy and rehab, to get back to your normal activity level, especially before returning to sports. Recovery time can definitely vary based on your age and also your activity level prior to tearing your meniscus. So I hope this helps clear up some of the questions you have about meniscus tears. If you have further questions, feel free to email me. Or if you think you may have a meniscus tear, I'd love to see you in the office. You can call my office and schedule an appointment, and we'll talk about it then. Thanks.